All right, welcome everyone. Thank you for coming out this afternoon. I'm very excited to welcome our speaker for today. Meredith Dost is currently a postdoctoral fellow at the Institute for Research on Poverty at the University of Wisconsin. Is working in residence with the U.S. Department of Health and Human Services as part of that fellowship. Among her many accomplishments, perhaps the most important is that she received her undergraduate degree from William & Mary in 2013, where she double majored in public policy and Hispanic studies, and wrote an honors thesis on representative bureaucracy and Latino student achievement in U.S. schools with Paul Manna and some other faculty. And she joined us today to talk about some of her more recent research on administrative burden, which has become an incredibly hot topic and important topic in the field of health policy. And so we're excited to have her with us today. So please join me in welcoming her back to William & Mary.
Great. Thank you so much for the introduction, and thank you everyone for being here. I'm, very excited to be back in Williamsburg and at William & Mary with some very dear people to me that have helped me a lot on my professional journey. So just before I get started with this, just to share a little bit about kind of how I got here today from where I was sitting in your seats. Yes, graduated from William & Mary in 2013. And then I was working at Pew Research Center in Washington, D.C. As a research assistant, doing all things surveys in the U.S. politics area. And then I was getting my Ph.D. in government and social policy at Harvard for 7 years. And there I studied some of these topics, among other things. And so now, since I got my PhD, I've been at a postdoctoral fellow, a national poverty fellow at the University of Wisconsin-Madison, and in residence at the Office of the Assistant Secretary for Planning and Evaluation. It's a mouthful, ASPE, at the U.S. Department of Health and Human Services. So I just mentioned those things just to say that at the end, we'll have some time for you all to ask questions or just comments, reactions, anything. I'm also happy to talk about kind of the professional journey aspect or even, off the record, my own personal perspective of, my current postdoctoral fellowship. So then last thing of introduction is that I have to say, this is all my own personal research. This does not reflect necessarily the views of the U.S. Department of Health and Human Services. All right, so I'm here to talk with you all about administrative burden, which I believe is a really critical way that the U.S. government interacts with ordinary citizens in the U.S. And so that's one of the reasons kind of why I study it. So to just kind of convince you all that this is something that today is is a topic of interest to be studying, to be thinking about. This is a headline from 2 days ago in the New York Times. Social Security Administration will no longer allow changes made by phone. Okay, might seem kind of innocuous, maybe not. Really what this is it's a way that the federal government is a federal government agency, the Social Security Administration, is changing the way fundamentally in which people can enroll in programs provided by the SSA or do things like update where they get their direct deposit and things like that. And the Social Security Administration, provides Social Security, which is kind of like the retirement for senior citizens in the U.S. It also provides disability insurance, supplemental security income, which is supplemental income often for people who are low income or on disability, some combination. And it also administers Medicare, which is the health insurance for the senior citizens in the U.S. So this rule affects about 20% of Americans in the U.S., but making it so that people cannot enroll or update their information by phone and forcing them to do it either in kind of a clunky online portal or in person creates actually really big administrative burdens on some of the people trying to access these really important programs. Now, probably disproportionately, it is impacting people who are older, have low internet access, might not be as well equipped to, go online, enter in all their information, do identity verification and things like that. This is not the only thing going on related to Social Security right now. There's also a lot of Social Security offices that are being closed. Actually, about 47 of the about 14, I think it's actually maybe 1,200 in the US, are being shuttered now. And that's the Department of Government Efficiency, DOGE, that is mandating their closure. So again, this is creating unequal administrative burdens on people, kind of depending on, is your Social Security office the one being closed? Do you have to now travel farther in order to enroll in Social Security, update key information? I'll also add that nearly all of the office closures are in the South or the Southeast US. So disproportionately in states that have higher poverty rates than the rest of the US. So this is like lots of already we're seeing administrative burden and kind of inequality combining to show that there's this variation across the US. So today I'm going to tell you, now that I've been using the word administrative burden, exactly what it is, what the kind of definition in the literature is, tell you what the kind of key claims, key things to know about burden are, how I go about measuring administrative burden in my research, and showing you kind of the application of measuring administrative burden in a case that I've looked into a lot, which is Medicaid and the Affordable Care Act. Hopefully for some of those with health policy interest, that'll be of interest. Then we'll talk about what the consequences of administrative burden are, and I'll have some concluding remarks and question and answer. Okay, so what is administrative burden? The definition in the literature is that it is the experience of policy implementation as being onerous. Yeah. Definition. Look at the name of the author. That's not a typo. That's Barry Burden. Yes, who's at the University of Wisconsin-Madison in the political science department. I always remember who came up with this idea. Right? Yes. I've been asked before, is that a typo? And I said no. So burden exists anywhere there's interactions with the administrative state. So even like government policy or programs that are easy to access, there are still burdens. So it's just the fact of interaction that there are burdens created. Now, of course, it varies in how much. So where specifically might we find administrative burdens? One common area, and this is what I look into in my research, is with government programs or policies. We typically tend to think of government policies as kind of fitting into two different buckets. So government programs, one would be means-tested programs like Medicaid, which means that there are eligibility requirements based on income or assets that you have. So typically, means-tested programs are for low-income individuals and families. And then there are universal programs. So something like Social Security, it would be considered a universal program, even though you have to be of a certain age to receive it. And there are some other small little details in there, but it is not means-tested. So the other place you might find administrative burden is just with like other really kind of ordinary government functions or services. So here are just like a couple examples. This is not an exhaustive list, but at the DMV, like when you go to get your driver's license, things like that, a state ID, those interactions, that's administrative burden too. And then the administrative burden of like registering to vote so that you can vote, of actually the burden of waiting in line on election day or for your early voting, that's also a type of administrative burden imposed by the government. So the takeaway here, where are they found? Everywhere. Everywhere there's interaction between the government and citizens. And I should add that when I say citizens, I don't mean I mean a very expansive kind of political science definition of citizens, which is not like, are you a US citizen? It's like, are you like someone who is living in the United States kind of and potentially interacting with the government? So that's what I mean. Okay, so administrative burden in the literature, and this is mostly Pamela Hurd and Don Moynihan, those scholars, have shown that there are three different types of costs of administrative burden. There are learning costs, psychological costs, and compliance costs. So learning costs might be things like learning about what benefits are even offered, what the eligibility requirements are, and just how to apply. Psychological costs are like the perceived stigma of being a recipient, or just even any emotions that are associated with the process of like applying for or enrolling in a program. And then compliance, those are costs like time spent on paperwork, gathering documentation to verify that you are who you say you are, you live where you say you live, and things like submitting the application, all of those logistics. So just to get a little bit more concrete about some of these costs, I want us to think about like just some examples of one tiny part of a compliance cost, which is the verification documents that you need to like prove who you are. So if you're applying for a program, a government program, particularly means tested programs, you might have to show bank statements. You might have to show recent pay stubs, past tax documents, employer related statements, other verification of every little type of income that you receive, utility bills that show your name and current address. And then in some cases, even like original or certified documents of a birth certificate, social security card for every person in your household. And then in some cases, you have to prove that you're searching for a job. All of these things together, combined with the mountain of paperwork that people have to complete in order to enroll in programs, just amounts to what I would argue is a pretty burdensome process in some cases. Now, of course, not for every program, not in every state, as I'll show you. Is this equal or is this as burdensome? But this is just to give you like a taste of what some of the costs might be. And one last thing here is that these might kind of look like, oh, these are all compliance costs, gathering the documents, filling out the paperwork. But administrative burden kind of all of the different types of costs kind of combine together in a way. Like there are emotions associated with this. When it's hard for you to find the birth certificate and you're frustrated or overwhelmed, you have to go to a local court or your, city council to get a new one. Like there are emotions there, and that's psychological costs as well. So this is the book on administrative burden. If you're interested in any of these topics, it's super accessible and great. I recommend it. And they kind of make three key claims about administrative burden. The first is that burden is consequential, meaning it can affect a wide range of outcomes. And we'll later talk more about what we already know it affects. It's distributed, meaning it's more likely to affect people who have fewer resources. So like I said, the Social Security Administration is closing offices in states that have a higher poverty rate than than compared to other states. That's a distributed aspect of burden. And then finally, administrative burden is constructed. It doesn't just like exist, pop up. It's not magical. It is produced by individual administrative and political choices. Okay, so now kind of shifting into a little bit about like what I'm hoping to contribute to this field, in part is, a methodology, a framework to be able to measure the administrative burden of any government function, program, etc. So I argue that administrative burden really needs to be measured across multiple dimensions by program or policy, meaning that like the administrative burden of Social Security is different from the administrative burden of Medicaid. And that's due to different policy design choices. Then also that burden will vary across geographies just due to the nature of federalism in the US. A lot of these federal policies are being implemented by state and county or other local governments. Next, burden needs to be measured over time because it can vary over time as either the political context changes or sometimes like policies and programs themselves, like the rules can change. And then finally, ideally, we want to measure administrative burden by individuals because certain types of individuals might have, more trouble dealing with administrative burdens. This is getting back to how burden is distributive. Now, that being said, I say ideally because it's really hard to measure like across geographies and over time and at the individual level at the same time. So the work I'm going to show you, I take the approach of measuring administrative burden at the level at which it's administered, like the level of government at which it's administered, which means I'm not capturing like individual variation in administrative burden, but I'm able to measure by program, across geographies, and over time. Okay, so getting into Medicaid and the Affordable Care Act. So just making sure we're all on the same page about what I'm talking about. Medicaid provides health insurance for low-income individuals and families, about 1 in 5 Americans, and 2/3 of the public, 2/3 of Americans either have themselves received Medicaid directly, either currently or in the past, or have a close friend or family member who has. So this is a massive policy that affects either directly or indirectly a majority of Americans. Medicaid is a joint federal state program, which means it's funded by both the federal government and the state, and so it's administered by the states, and that leaves this great potential for variation in how it's administered if states get to decide. So the Affordable Care Act, also known as Obamacare, was passed in 2010, and this directly concerned Medicaid. This was revising how the Medicaid program functioned. So it was passed in 2010 and then implemented in 2014, which basically meant that's when in 2014, January 1st, actually, that is when states had to comply with all the provisions of the ACA that was passed by Congress in 2010. The ACA included a couple key things that I'll highlight here. One is it gave the option after the 2012 Supreme Court decision for states to expand Medicaid. The second thing is that it required all states, no matter what, to streamline their enrollment and renewal processes. This is the key here. The Affordable Care Act basically served as a shock to the administrative burden of the Medicaid program by forcing states to do things like eliminate face-to-face interviews at renewal time to keep someone enrolled in Medicaid, and many other things. You have to be able to have an online application in every state. Today, that seems like duh, but it was not in 2010. Okay, so I created an index measuring Medicaid administrative burden. And this table, you do not need to read it all, but this is 31 indicators of like little bits of Medicaid administration of data that I was able to collect in every single election year or even year between 2010 and 2020, and in every single state. So basically, my goal was to be able to apply my framework about how to measure administrative burden to the case of Medicaid in the time period surrounding the implementation of the Affordable Care Act. So what I did is, I went to the Kaiser Family Foundation, a nonprofit research institution, their website. They do surveys of Medicaid state administrators. I used the Internet Archive, like the Wayback Machine, to look at state Medicaid websites in the past, see how accessible they seemed. Are you able to access the application easily? Things like that. And so these are all of the measures that I could get in every single year. And you might notice that some of them are bolded, about 8 of them, things like the ability to upload verification documents online, like rather than bringing them in person. These are bolded because I conducted a small number of interviews with means-tested program recipients. And the ones that are bolded are the ones that I heard over and over were like the salient things to people, the barriers to accessing Medicaid, to actually enrolling in them. So I conducted these interviews primarily to evaluate and validate my measure. Am I hitting on the things that people with lived experience with Medicaid are actually experiencing? So what I did with all 31 of those measures is, so I will say, and this is can be something in the Q&A if you're interested in. I tried to combine these so many different ways with various methods, et cetera, to think of what is the best way to compute this index. But what I ended up doing, because everything gave me the same results, is I just created something really simple, which is an additive index. So basically, each of these indicators are like 0, 1. Can you renew via the telephone or not? And so you add up those things. You'll have a score from 0 to 31. And then I scaled it from 0 to 1, just as you'll see for our interpretability. So basically, 0 would be the lowest administrative burden, and 1 is the highest. So here, this graph shows you my Medicaid administrative burden index. And it ranges, you can see from, this is the average in any given year, so across all states. So the average ranges from 0.3 up to 0.7 about. And so 0.7 would be about, I think, 23 of the 31 indicators, so 23 burdensome indicators out of the 31 were present. And so this is the average. So this shows you that on average, or the typical state in 2010 had a relatively high level of administrative burden for Medicaid. Well, what do we see here? The implementation of the Affordable Care Act really dramatically reduced administrative burden in Medicaid. It was actually a huge success in that way. And this is an example of how policy design can affect burden. Now, in studying U.S. policy, we don't often have huge policies like the ACA that come around, and really there's an opportunity to design things in a way to lower administrative burden. But I mean, my research would indicate that when we do, policy design can be a way to really effectively lower administrative burden. So sometimes I actually don't like showing this graph because it obscures a lot of things. And what it obscures is this two things. One, across state variation in burden, and two, over time variation. So, and I'm going to show you that. So here I'm going to show you a map of the US and every year in my data set between 2010 and 2020. And so this ranges from 0.133 to 0.77. Basically, the real observed values of burden in my data set go from having only 4 burdensome measures to 24. So a 20, indicator difference. And so, okay, these maps are pretty dark colored, and dark colors meaning high burden, light colors meaning lower burden. Yeah, burden was pretty high. There's some variation here. It's kind of hard to tell, but there was, but burden's pretty high. Okay, in 2014, just add for additional context, in stripes, the states that started expanding Medicaid, which was a choice. And we start to see just a lightening over time of the map overall across all states, meaning a lowering of administrative burden. But yet, there are still variation, even in 2020, of burden across the states, but also we see that there's variation within state over time. And so here, this is an example of how policy implementation can create variation, right? So meaning that each state got to decide how the same policy was going to be implemented. And so some states said, oh, I'm just going to, take the requirements of the ACA and make things easier in those ways. And other states had this moment of reckoning or reevaluation of their Medicaid program and said, we're going to evaluate everything and maybe also change, the ways in which it's administered above and beyond what's required. Okay. So now kind of shifting back to what do we know about administrative burden, with a little touch of what I do. So basically what I've just shown you is that, we can measure administrative burden systematically. I'm hoping that, I'm convincing you that you need to, when you're measuring it, you need to be looking, over time, across states, by policy, things like that. But administrative burden, then it's so what? So there's this variation, there can be this variation. Well, administrative burden has some really real consequences. It may reinforce various types of inequality in the US. It might reinforce inequality like socioeconomic and racial and access to, say, programs, maybe political or geographic or place-based inequality. So there's research by Ashley Fox and colleagues demonstrating, looking at the administration primarily of SNAP, which is the Supplemental Nutrition and Assistance Program, providing like vouchers for food, and then also TANF, which is the Cash Assistance Program for very low income families. And they demonstrate that the more burdensome those programs are, what do we think? Are more people enrolled or less enrolled in the programs? Less, more burdensome, just what you would think. It makes sense, right? Less people are enrolled. But this is something, because this is kind of a relatively newer research field in the past, 15 years, that maybe even less, that this needs to be demonstrated, right? In my research, because I'm coming, from a political science department, a political science PhD, I was really interested in how the variation in administrative burden of Medicaid affected voter turnout. And so I find that, again, kind of what do we think is likely to happen here? That at its Medicaid administrative burden got higher, even community level voter turnout was decreased. And by the way, I hypothesize that's because, and there's a lot of sociology and political science research that shows that when people interact with the government, there's a lot of political learning that happens about what the government thinks about them, just their own sense of like political self-efficacy, their ability to kind of like have a voice in politics. And so I find that there's this kind of downstream negative effect of higher Medicaid burden on voter turnout. There needs to be, and where I'm going in the direction in my research is looking at what is the effect of administrative burden on health outcomes and also well-being outcomes. Really the key here, and then moving into kind of the future research directions as I wrap up, is that based on what you all or what scholars are interested in, there's just so many ways that this could go, examining, measuring the administrative burden of, your government policy or program of interest, and then seeing what types of outcomes it affects, depending on what you're interested in. So not just policy take up, not just, political participation, but other things too. The other area that I really see as very fruitful going forward in this field is, explaining what are the origins of administrative burden, right? So we've been talking about like, here's burden, how do you measure it, and what are its effects? But then backing up, how do we get there? Is it just simple politics, the preferences of political leaders? Hint, in the case of Medicaid administrative burden, I found that it's not. It's not just about the, political party of the governor or of the legislature or of the people who live there. I'm trying to figure out what does explain it. Is it just about intentional choices being made by career bureaucrats? And by career bureaucrats, I just mean like non-political appointees who are working for the government who might be like administering the program, or something else entirely. So I think that these are kind of where the field is going, in my opinion, or kind of where like the open ends are. I think it's an exciting area of research to be in. And of course, hopefully this isn't surprising to you by now, I expect that explaining the origins of administrative burden are going to really vary by policy, over time, by state even. I wanted to end on a positive note because sometimes it's administrative burden. So in the prior presidential administration, there was some great recognition of the administrative burdens that people face when they're accessing government services, even using administrative burdens by name, right? And they have it in quotes. But that's because it's coming from the academic literature, and it's cool to see it kind of weaving between different, real life and policy practice and the literature. And actually, there's a lot of research. There was a lot of research in the federal government going into how can they reduce burdens and just streamline program enrollment. And then because we're here in Virginia today, I just wanted to say that I don't know all of the details, of course, about what it's like to apply for a means tested program in Virginia. But there are some states, and I found out that Virginia is one of them, that have really tried to make it easier to enroll in programs by having one common application for them. So people are often eligible. It's a similar eligibility requirements for Medicaid, for food stamps and vouchers, for cash assistance, for various types of things. And so some states are making it easier. By the way, multiple languages. There were many things that I liked about this. commonhelp.virginia.gov is where I found this. So I just want to say that I think in terms of real policy practice, there are some positive things going on right now too. And probably most of that's going to be at the state level in the coming years, if I had to guess. So that's all I have to say for today, but looking forward to hearing any questions and comments. Yes.
Oh, wait, I've got a mic.
Oh.
I've got a big one.
Just to pick up on the video.
I've got two questions about your measure of administrative burden. The first goes to the original definition, which had to do with the experience of these interactions as onerous. In your 31 measures, how do you know that all of them feel onerous to people? For instance, if I go to DMV, I might expect to be there 30 minutes. I'll bring a book. It doesn't feel onerous to me, but it might feel onerous to somebody else. Second question is, you indicated with the bold that some of these things were mentioned more often than others. In your index, did you weight them more heavily?
Thank you so much for your questions. Okay, so first, in the measure, I have all of those indicators. How do I know, first of all, that might be onerous to anyone? You could say it would be kind of the first order question. And then it's like to you versus you versus you. There's, that potential for variation there. So every measure that I had, because I was in this case, this was a primarily quantitative project. And my book project, which I'm talking about in a different forum tomorrow, is going more qualitative. But these interviews were conducted primarily to validate my measure. And so there were a couple that I kicked out, that things like how many clicks to get to. I thought that it would matter, like how many clicks on the website to get to the application, like 1 versus 5 would matter. People are like, well, if it's easy to find where to click, that doesn't matter. So I guess I would just say that I feel pretty sure that my measurements there can be onerous for some people, but then how do I know that it feels onerous to everyone, or that these are always burdensome? I don't. And when I'm trying to measure administrative burden to do this large N study and look across states and across time, it doesn't work methodologically. And so that's why my future direction with this and creating more precise measurements will vary at the individual level, even for policy. And then the second question was about, I had those measures that I said people mentioned a lot. And so that I had bolded, those 8 measures, did I weight them at all? And I have in a different talk type of setting, I show, here are all the different ways I measured it. I tried only using those measures. I get the same substantive results on when I'm looking at voter turnout, and the maps look kind of similar. Also, if I take all of those 31 components, put them in, a factor analysis, and then weight by kind of loading or things like that. Basically, what was remarkable is there were 5 or 6 different good ways that I tried to kind of weight things or combine measures to create the index. And they all came out substantively extremely close, which is why I end up presenting this additive measure, because it's so much easier to understand. So. Thank you. Yeah.
Any other questions?
There you go.
Yeah. Yeah, thank you. I'll get my water. Yeah.
Hello. I noticed the analysis ended at 2020, and I was wondering if you've looked at 2020 to 2024, and if you haven't, are you planning to do so, and what do you expect?
Thank you for your question. So I have not looked at it in the systematic way in terms of like measuring it for every state that I have for that previous decade. But what I do know is that with the COVID-19 pandemic, if I measured the administration as of January 1st, 2021, 100% the administrative burden would be lowering in at least 2/3 of the states. And that's because there was a real effort for digitization when the pandemic hit. And so I think that that's what I would find, just an overall even lessening of burden. At the same time, I still believe there would be differences by state, just based upon the literature and the prior decade. And that's something that going forward, I do want to continue kind of extending out the measure. Probably won't continue then studying as much on how the Affordable Care Act affected voter turnout, just because it starts to be a little bit too distant. But yeah, I think it's a great idea to like continue this measure, right? Like time doesn't stop. So.
Well, mine and that's about it.
Here.
What?
As you know, and certainly people in my department know, but I just sort of, I guess last night I was thinking about something very different, NPR and PBS, and how much each of them gets from the federal government, and it's huge difference, right? The PBS gets a lot, and NPR gets much less. I'm just sort of curious. I mean, what are the programs in which, I guess the question is the relation of state requirements and federal requirements. So when you look at Medicaid, the Affordable Care Act, that's a federal requirement, and it impacts the state. And so I guess, yeah, I guess it is a question of state variation.
Yeah.
How much of the administrative burden is sort of mandated at a higher level and how much at a lower level, and for which policies in particular are those different?
Thank you, Ron. So especially because I've been studying Medicaid, I thought a lot about the money in this, because most states are getting billion with a B dollars from the federal government. This is a lot of money coming in. And for states that chose to expand Medicaid, which meant that there was a newly eligible population of adults with a slightly higher income threshold, that would be even more money potentially coming in. So so I will say that states had to be in compliance by January 1st, 2014 with certain aspects of the Affordable Care Act, or their funding was at risk. So that's also a reason why I observed nearly full, but not 100% compliance with the measures that are the federal ones. So 6 of my 31 indicators in the index are ones that in almost every state, 2014, basically after 2014, those burdensome indicators go away for 6 of those 31, and the rest is state variation. And I also tried in the index where I only include the ones that are, state variation, and again, kind of similar results there. But so a program like SNAP, so food stamps, typically, I think what this research by Ashley Fox and colleagues has found that there's a little bit less variation in how the program is administered at the state level compared to Medicaid and compared to TANF, cash assistance. And I think that absolutely is about a policy design. So states just have less autonomy about how things are administered. Now, an example of a policy where I would expect to see perhaps even greater variation in administrative burden than Medicaid, which already I would say has a lot, is like with public housing or Section 8 housing vouchers, because that's something that it's very local, depending on your state. It could be at the county level, how those are administered. And sometimes it's like block grants coming from the federal government going to states, which is essentially like, here's a pot of money, please spend it on this policy. with some reporting requirements versus like, here's $10 million for X specific thing about a policy. I know you know this, but for the broader context of the group. So yes, I think that there are definitely lots of variation by policies, and hopefully answered part of your question there. But the money question is also a direction I'm going in, kind of the political economy of burden.
Since we're on the topic of state variation, I was wondering if you could provide some context for Medicaid work requirements as a particular type of administrative burden and the kind of potential for that as we're thinking about our contemporary, sort of political context and thinking about Medicaid in the future.
Yes. So Medicaid work requirements. This is something that if you happen to be following some, news and things regarding Medicaid and the rollout of the Affordable Care Act in the, late 2010s in particular, and especially also during the first Trump administration, there was a lot about Medicaid work requirements. Well, so first of all, what does this mean? It means that in a state that has a Medicaid work requirement, like people have to prove they're searching for work or that they're working, 80 hours per month, sometimes per 2 weeks. I mean, there's various depending on the state. So, and how do states do that? This is something that it's considered kind of like an irregular way. It needs permission by the federal government in order to do this for your Medicaid program. And you do that through what's called a section, it's like 1115 waiver. And so the states that wanted to have work requirements in the second Obama administration were essentially ended up being shut down by the federal government, or they were held up in court. Basically, a state applied, they said, we want to do this, and it was found to be basically, they would not have used these words, but essentially like too burdensome, too contrary to the point of the program, which was to get people Medicaid health insurance. So that being said, Indiana, Kentucky, I want to say Wisconsin might have tried, but like there were 4 or 5 states that attempted in a really serious way to institute Medicaid work requirements, and some were successful and some weren't. And so I spoke with people in Kentucky, and I, was strategic about where I was choosing to interview folks. And in Kentucky, Medicaid was like super high profile for the gubernatorial elections in 2015 and in 2019. And so when I was speaking with people, they were like, I don't even know if there are work requirements, but I'm like really scared about having to comply with them. It was never actually implemented, but people thought it was. So I think that work requirements, just based on my conversation with folks, have the potential to like almost be a type of burden that even if everything else was like easy and not there, that if there are work requirements, that just like crosses some threshold of administrative burden. Especially for Medicaid, which is a program that has not had that as part of the program before. So yeah, that's something that'll be interesting to see if there are more of those in the coming years. Those kind of waivers approved if states apply to the federal government and the federal government says, sure, go ahead, and courts don't block it. So we will see.
I was wondering if you were able to draw any meaningful commonalities or otherwise explanatory variables among the states that had particularly high levels of administrative burden.
So this to me sounds like kind of getting at like kind of what I was getting at the end of the talk, which is, so how do some states end up with maybe say similar levels of administrative burden or different, or like how do we get this variation? Is that kind of thumbs up? Okay, great. So I have still not been able to figure this out. So but I think in a way this is a finding in and of itself that it's not simply, was the governor in power, because governors in some states might actually be trying to be involved in Medicaid administration, though not all states. It's not about the governor's party. It's not about the state legislature's party. It's not about how what the kind of partisanship of the general public is, or of voters, which I measure as like what the vote share was for Republican in the prior presidential election or things like that. So again, of course, as with my political scientist hat on, like that's what I looked at first, was politics. And I think based on like what we know about administrative burden being constructed, meaning it doesn't just like pop up in existence, I really thought there was going to be something there, and I tried it so many different ways. So this is like truly a current area of inquiry. I have to say, one direction though I'm going in, I don't think, by the way, that there's no politics in it, right? Like I think that understanding better in a given state at a given time, who was making the decisions about how Medicaid was being administered, right? Like who was kind of the final go person, like, yeah, we want to do this or that. And that could be considered a political decision, right? But like I just haven't been able to measure that yet. So thank you for the question.